The amount of hair loss that we see in male pattern hair loss changes from each patient. Everyone's a little bit different. Some patients have a little bit of loss. Some patients have really advanced loss. In fact, if you have too advanced loss, we might not even be able to do a great restoration, and certainly not in one procedure. But even with significant loss, you can get a very nice improvement with one procedure. And this case is typical of that type of scenario. So let's take a look. This patient has recession all the way across the frontal hairline. There's really not much sparing in the center here. All of this frontal area has drifted back, and you can see a lot of thinning throughout the scalp. Now, that is something that's a little harder to fully restore because you can't get great density with one procedure. Frequently it takes two procedures, but you can get a nice improvement with only one procedure, and here you can see it. After 3,600 grafts, you see a good restoration of the hairline, and you don't see that thinning throughout this whole frontal area either. So much so that this is a pretty typical change that we see. You don't take a look at what's on his head, take a look at what's on his face. Before surgery, a lot of guys will grow a goatee or beard, and it's almost like compensation for the thinning on their head, and they grow it out on their face, and it fills in the amount of hair that they kind of feel they should have. After restoration, when the head looks more full and the scalp has more hair, everything looks better, they have a higher level of confidence, and suddenly that goatee gets shaved off. And here you see that, a clean face, full head of hair, and a bigger level of confidence. 3,600 grafts is a good amount of grafts to get a nice result with one procedure, even with this amount of hair loss.